Dear Fragile X Syndrome, we ask the family members and friends of those with Fragile X Syndrome to comment on their experiences in writing Dear Fragile X Syndrome. This is a compilation of their responses. You may think we don't know you, but we know you better than you think. We know what causes you. We know that you are a genetic condition caused by two main things, the gene and the protein. When there is a mutation on the gene, FMR1, the protein, FMRP, either isn't produced at all or not enough is produced. This develops issues within the brain resulting in difficulties with cognitive function. These mutations can be passed on genetically, so even though the mutation doesn't occur very often, there are a number of people with the condition. Fragile X syndrome is caused by a full mutation that prevents important proteins from developing properly. Mutations, like the one that results in Fragile X syndrome, can cause disorders because when DNA coding is altered, it changes how a certain being functions. These mutations occur when DNA is copying itself in preparation for cell division. The mutation that causes Fragile X syndrome lies on the FMR1 gene on the X chromosome, where there is a pattern of nucleotides, CGG, 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 that repeats itself. On a normal FMR1 gene, this pattern occurs 10 to 40 times, but in a full mutation, which causes Fragile X syndrome, this pattern occurs over 200 times. Having too many of these repeats blocks the gene from being able to produce the proteins it needs to produce. The FMR1 gene codes for the protein FMRP, which is vital to cognitive function. The main job of the FMRP protein is to stop the mGlu-R5 protein when it has completed its job. The mGlu-R5 protein tells the neurons to grow dendrites. Dendrites are long, narrow parts that attach neurons to other neurons and serve as the connection between neurons, transmitting information between them. Because of this, dendrites are vital to proper cognitive function. Normally, when dendrites are the right size and shape, the FMRP causes the mGlu-R5 to tell the neurons to stop growing. For people with Fragile X syndrome, the FMRP isn't present or present enough, causing the dendrites to grow wildly and uncontrollably. Because of this, signals within the brain can be easily lost, which decreases cognitive function significantly. We know your symptoms. While the most significant symptoms of Fragile X syndrome are developmental delays, many other disorders can result from Fragile X syndrome. Symptoms can range from a normal IQ with mild learning disabilities to severe intellectual and behavioral disabilities, much like autism and Prader-Willi syndrome. Physical symptoms include prominent ears, a long, narrow face, flexible finger joints, and flat feet. Mental symptoms include delayed speech, delay in crawling, walking, and talking, hyperactivity, and short attention spans, but the list goes on and on. We know you have no cure. We know that there isn't currently a cure for Fragile X syndrome, but there are many therapies to help those with the disease function properly, as well as a few medications that can lessen the symptoms. While there aren't any medications specifically for Fragile X syndrome, other medications can be used for specific symptoms. While these therapies and medications are able to ease the symptoms in many situations, most symptoms still remain despite therapy and medication. While there are various clinical trials and other efforts to help find better medications for Fragile X syndrome, there isn't a bright outlook in the field. But we will not stop searching. We know you like to hide. We know that another issue with Fragile X syndrome is that it often goes undiagnosed because many people are unfamiliar with the condition and because many people still believe that girls can't have the condition. While there is currently an effort to raise awareness, many people don't know about the disease, which results in many cases going undiagnosed and a lack of funding for research for a cure. Many patients are diagnosed incorrectly, as in children, the disease is often confused with autism and Asperger's. Fragile X syndrome is a very serious condition that affects the lives of many people in the world, and there isn't a very strong effort to spread information and understanding of the disease. It is very important that people understand Fragile X syndrome so that the condition can be diagnosed correctly. It's absolutely outrageous how few people know about Fragile X syndrome, and as a result, the condition receives very little funding and support, despite the fact that it is a very common condition considering its caliber. It may not be a commonly known condition, but more people need to be knowledgeable about Fragile X syndrome because it is a very serious condition. We spend every waking hour trying to weaken you. We refuse to rest until you do. We come together in all climates. We call on all faiths. We search with technology and genetic studies and therapies and prayer. But we are a community of warriors. We may come from different areas, but we speak only one language. We speak love, and we will shout over your destruction. You may not be known to many, but you are known to us, and we will stop you. Go to www.fragilex.org to find out how you can help.